3 years ago, Destiny Toro fell ill. And since that day, her life has changed forever.
Around the time that I turned 30, I suddenly woke up with a stomach virus, and everything changed. I recovered from the initial stomach virus, but symptoms continued to grow.
Doctors had diagnosed Destiny with an incurable genetic condition that required frequent and careful medical care.
This was all of the appointments and testing that I was able to get in Louisiana that I didn't have to pay for out of pocket. That was covered by Medicaid.
The Affordable Care Act, commonly known across the U.S. as Obamacare, expanded access to government health care for low-income families. 15 million Americans, just like Destiny, were able to qualify for the Medicaid expansion program, which meant that as a result, costly medical bills would be covered in full.
When I got sick, I had the opportunity to go immediately to seek help. The process for diagnosis, especially of something like Ehlers-Danlos syndrome, is a very long process, a very complicated process, but I had access to doctors.
But little by little, her condition worsened, and soon, Destiny could not take care of herself alone. She moved to Texas to get help from her family, but that soon complicated her access to affordable treatment, leaving Destiny paying hundreds, sometimes thousands of euros out of pocket for treatment and medication each month.
I'll sit here and watch you. I had to pick and choose which specialist I could see with the little money that I had. Our life is in limbo. My life is at a standstill until I can get the help that I need.
In the United States, Destiny's situation is far from unique. She is one of 50 million Americans with chronic pre-existing conditions such as cancer, diabetes, hypertension, or heart disease. Obamacare originally guaranteed that these Americans kept their access to health care. But since its ratification, Republicans have led a crusade against the iconic reform of the Obama era.
The yeas are 60, the nays are 39. The Patient Protection and Affordable Care Act is passed.
In 10 years, Republicans have tried to overturn the Affordable Care Act at least 70 times, and with little success have turned to unraveling the law little by little.
We will never let socialism destroy American health care.
Robert Hennicky was one of the lawyers leading the Texas lawsuit that ruled the Obamacare individual mandate was unconstitutional. That verdict will soon be re-examined by the U.S. Supreme Court in Washington, which now leans conservative.
The architects of the Affordable Care Act created the individual mandate. That concept, first of all, is unconstitutional in the United States for the federal government to command people to purchase a product that they do not want.
As a result, having health insurance is no longer mandatory in the United States. A recent study found that 30 million Americans don't have any coverage, a 30% jump since before Obamacare. Policy experts say it's because there are no federal regulations on premiums and deductibles, which are the costs of subscribing to a policy, resulting in a continual cost increase over the last 10 years. In Pahrump, a small rural town in the state of Nevada, this high school has been turned into a field hospital that's free to all. Here, the COVID-19 pandemic has devastated the community.
I feel for the people that were out of work all this time and get unemployment, and they have to still pay their Obama plan, and they don't make it with $400 a week, plus to pay your insurance.
This couple arrived at dawn to see a doctor for free, a ritual that they do here every year.
She's 93.2.
Have you felt like you had a fever in the past day?
No, ma'am.
Worsening cough?
No.
You understand that you're at serious risk if you go in there?
Yes, ma'am.
Okay.
Inside, the school gymnasium has been converted into a giant dental clinic. Waiting anxiously is 18-year-old Janet. She pays 250 euros in monthly premiums for health insurance, but her plan doesn't cover dental, even under Obamacare.
The money that I'm paying, it's kind of not really worth it. I'm better off not even paying it than, paying for it, because I'm not even getting dental or vision or anything like that. I'm having to pay out of pocket.
Emptied of its substance, the future of Obamacare is now more than ever threatened in the United States. If the Supreme Court votes to overturn the law, more than 50 million Americans could lose their medical coverage, all in the midst of the COVID-19 pandemic.